Hi. Can y'all hear me now? Yeah. Okay. Well, thank you everyone for joining us. I feel really excited to be on this panel with, two other journalists who have been reporting heavily on access to abortion in Indian country. And so I thought it would be really sweet if we took the time to introduce each other. So Allison's going to go first. And yeah, go ahead, Allison. Oh. Okay, that's okay. That's okay. They have buttons for them, yeah. Yeah. You have to.
Hello? Oh. Dang.
That's okay. Thank you. Thank you. Yeah. I can also go first and start with introducing Pauly. No worries. Pauly, I meant to check in with you about how to pronounce some things, so I'm so sorry if I don't get it right. Okay, thank you. So yeah. Okay, so Pauly Denetclaw is a citizen of the Navajo Nation, is of the Meadow people, born of Towering House people. She is the political correspondent for ICT and is based in Washington, D.C. An award-winning reporter from Gallup, New Mexico, she has worked for the Navajo Times and Texas Observer covering Indigenous communities, and her radio pieces have aired on KYAT, National Native News, NPR's Latino USA, and Texas Public Radio. She is a board member of the Native American Journalists Association, where she serves as secretary.
Awesome. Thank you so much for having me, everyone. So I am going to be introducing Allison. It's okay. I got it here. Yeah, here we go. Okay, so I'm going to be introducing the wonderful and amazing Allison Herrera. She's the Indigenous Affairs reporter for KOSU, the NPR affiliate in Oklahoma. While working there, she's covered the landmark Oklahoma versus McGirt decision, in which the Muskogee Creek Nation had their reservation ruled never disestablished and was viewed as a huge win for tribal sovereignty in the state. Herrera also worked at Bloomberg and iHeartMedia podcast In Trust about how Osage head rights and land came to be owned by one prominent ranching family in Osage County. Before joining KOSU, Herrera worked for PRX's The World, where she traveled to Ukraine to cover how the country's surrogacy industry affected women there. In 2019, she received funding from the International Women and Media Fund to travel to Argentina and report on reproductive rights. Herrera splits her time between Tulsa, Oklahoma, and Minneapolis, Minnesota. So thank you so much, Allison, for being here.
You're welcome, Pauly. Thank you so much for that lovely introduction. And I'm going to introduce Adreanna Rodriguez. Adreanna Rodriguez is Lakota and Chicana, and she is an artist based in Oakland, California. As a storyteller, her research, writing, and filmmaking revolve around issues of social and climate justice for Indigenous communities, as well as femme stories. While employed at Vice Media, she was a 2022 Ida B. Wells Fellow through Type Investigations, where she investigated access to abortion services in Indian country. This year, her investigative story, Roe Was Never Enough, was a finalist for the Third Coast International Audio Award and the recipient of a Gracie Award. So thanks, everybody, for coming to this panel, and I hope that y'all have some questions for us, and yeah, thanks a lot.
Yeah, really great to be standing up here with these two powerful journalists. So I also thought it would be really cute if we started out by introducing how we got interested in covering abortion in Indian country. So Allison, you're going to go first. So we'll trade places, and you can come navigate this computer. So thank you.
Okay, so in 2019, in the fall of 2019, as I was wrapping up doing reporting on abortion in Argentina, where I traveled to Buenos Aires and talked with a bunch of women working in clinics there and working in the position of advocacy, I was really interested in doing some reporting on access to abortion here for Indigenous women. And there was a paper that came out, I think it was through Harvard, that was called Roe on the Res, that really looked at abortion access or the lack of abortion or reproductive rights access on the reservation. And this particular scholar out of Harvard really took a deep dive and looked at the work of Cecilia Firethunder, who, if you're not familiar with, she was the former tribal leader of, why can't I remember her? She was really a champion of reproductive rights in South Dakota, and so she did a deep dive on that, and then so I started to look at that, and I started to look at wanting to get access to data about how much access Indian Health Service, which is one of the primary healthcare providers for Native women, how much access they provided. So I wrote this article for High Country News called "Indigenous Women Face Extra Barriers When It Comes to Reproductive Rights," and I interviewed Sharon Asatoyer and Pamela Kingfisher of the Native American Women's Health and Education Resource Center, and found that the statistics were pretty shocking. In 2002, they published this study that showed that I think it was 25 abortions were performed in the IHS system since 1976. And then, I remember writing this article and my editor, Tristan Atton, going "What? That number can't be right." So as I was working on this article, I filed a Freedom of Information Act request and asked IHS for abortions going back 10 years, from 2009 to 2019. And I also asked what the official policy was for IHS to provide reproductive health care, provide abortions for Native women, and in what instances would they provide them, especially since the Hyde Amendment restricts the ability to pay for abortions through Indian Health Service. So I was really taken by the fact that the number was so low. I filed my Freedom of Information Act request, and I didn't get it back until August of 2022, actually last year. And Adreanna and I got the same data set last year. And that data set was very incomplete, to say the least. IHS only says that they keep records for 5 years. And it was a lot of redacted information and really not that useful at all. So it's an ongoing story, but that's I guess that's how I got interested in reporting on the subject. Now it's like, reporting in Argentina about it for PRX, and then just really started to look at, what the barriers were for Indigenous women here in the United States. So, yeah. I guess, Adreanna, well, Pauly, why don't you talk about how you got interested in reporting on abortion access?
Yeah, so one of the things that I did want to provide is like context for this issue. So we're based in the United States, and in the United States, access to abortion care is extremely controversial. And so it's really difficult for people in some states to access abortion care. They're not performed at our hospitals on our reservations because, like Allison said, there's this law called the Hyde Amendment, which was passed in the 1970s, which is basically a Band-Aid solution that they came up with, saying that there are no federal funds that can be used for abortion care, any federal funding, and our hospitals are all federally funded. So that money, none of it can be used unless under like specific circumstances that involve rape, incest, or the life of the mother's in danger. But what we have, at least what we have found, is that even in those instances, it's not happening because most Indian Health Service facilities are not even capable of providing that type of health care. So even though they're allowed to in these circumstances, they still don't, because they don't have, they either one are very conservative communities, because even though I think that they like to say that Native communities are sort of these progressive places, right? They're really not. It's very conservative. And so a lot of places, including my tribe, abortion is not seen as something that you should do. And so it's very like a secretive sort of thing that happens in my community, and not a lot of women like to talk about it for the specific fact that it's highly discouraged to have an abortion unless the life of the mother is in danger. So for any other reasons, you should not in my nation. And so I'm Navajo, by the way. And I think that for me, the reason why I got into reporting on this issue is that access to abortion has been so important in my life, because my sister was a teen parent, and my sister got pregnant really, really young. And so my nephew is only about 3 years younger than me. And so it was always such an issue in my family where it's like, you are not gonna get pregnant, you are not gonna get pregnant. And so my mom was having these constant discussions with me about sex and about reproductive health. And then while I was in school, we had a huge number of teen pregnancies at my high school. And we had abstinence-only education, which means you don't have sex. Like, that's it. They have no other sort of sex education that happens. And so for those reasons, like when I went into college, I was like, if this were to ever happen, I knew that abortion was like an option for me if I did not want to carry a pregnancy. And while I was in college, my town, the city that I went to school in Albuquerque, became a hub, a center for outside groups to come in, and they were trying to pass a bill in our city that would ban abortions. It's called a heartbeat bill. So after a fetus has a heartbeat, you can no longer have an abortion, which is around, I think it's 12 weeks. And it's either 6 or 12 weeks, I can't remember. But the reason why they were doing that is because in my state, New Mexico, which is home to about 2 million people, including 23 indigenous nations, there is only one clinic that provides late-term abortion care. So this is oftentimes for women whose babies have abnormalities, and if they were born, they would be born with, abnormalities, like their brain is outside of their skull, like they would be in excruciating pain should they be born. And they go to this clinic in Albuquerque, New Mexico, where they can access that type of care, and it's the only place in New Mexico where you can do that. And so they were trying to, and then also they do abortions for people who have health issues, right? And so their life is in danger should they not have an abortion. And so anyways, that's a long-winded way of saying, like, this was under attack in my community. It was, like, so contentious. There were buses everywhere. There were people, like, out advocating that this should be happening. Women were getting harassed at all of these abortion clinics, like, in my city. And it was just a really horrific thing to witness, of all of these women just being harassed for accessing healthcare. Like, these people don't know why they're there. They could have had a pregnancy that attached to their fallopian tubes, and they could die, and, like, they don't care, you know? And so that's really where the heart of this discussion came for me. And I was lucky enough to also grow up in a home where my mother talked with me about, you know, my options and what I could do and how to access, like, birth control and all of those things. And so, yeah, that's, anyways, long journey.
Just one thing. So Cecilia Fire Thunder, she's the leader of the Oglala Sioux, and in 2006, as South Dakota was proposed this really restrictive abortion ban, she said, okay, well, we're just going to open up our own on the reservation. And she was impeached. Like, she was served from 2004 to 2006. And I think, just to piggyback off of what Pauly said, you know, there's a lot of, a lot of very conservative views about abortion and abortion access within Native communities. And I think that there is an assumption that, you know, Native people, you know, of course they believe that, believe in abortion access, but I think that that's, a lot of communities are really conservative, and especially in Oklahoma. And that study that I was talking about, it's by Heidi Guzman, and it's from Columbia, and she published it in 2018. So I just wanted you to know that. So.
Oh, I also wanted to add that they tried to ban Cecilia Fire Thunder from her own reservation, her own homelands, and she wasn't actually starting at the clinic. It was a woman's health clinic is what she was trying to start, and it was just a woman's health care facility. And they targeted her. They went after. I interviewed her. They targeted her. They went after her. It got to the point where she told me this beautiful story of how she, like, went up into, you know, her homelands, and she did this beautiful prayer, and she wanted to know what she should do. And what came to her is that basically she should just let it go instead of continuing to fight, because she was, after she got impeached, still fighting for her position. And Oglala Lakota, first in the nation, proudly by some of their membership, proudly say that they have the strictest laws when it comes to abortion access on their reservation. And I had a man from that community tell that to me, that he was proud that they have the strictest laws passed on their reservation.
Yeah, so going back to how I got interested in reporting on this topic, anybody who utilizes IHS as their primary healthcare provider knows, like, the limits and the struggles that come with just basic access to most care that they can provide. And even something as simple as, like, I mean, maybe this isn't simple, but, like, my sister has, like, severe allergies, and it's like we can't even get, like, an allergy test. And so I started thinking about reporting on just reproductive health care generally, and looking into what that looks like for different communities in different parts of the states. And I decided to hone in on abortion. And I started looking for data and numbers and statistics, and I was trying to find something where I can say, you know, TK number of, like, Native people receive TK number of abortions per year. And I realized no matter how hard I looked, I really couldn't find that information. Not from the CDC, not from like the state health reports. Like, all of the demographics for that were either, like, Native people as, like, an asterisk or a star, like, too small to count, or lumped in with other demographics. And so it kind of drove me crazy, where I was like, where is this data? And I just kind of went down a really deep rabbit hole of trying to find any information about that topic that I could. And then I came across at the time when I was looking, one of the only abortion providers for Indigenous communities, which is also based in Albuquerque, New Mexico. And so, yeah, that's kind of like my jumping off point, but I would definitely say like that this data component has really racked my brain with trying to find it, trying to get it from IHS. And so one of the first things I did as a journalist, which is something to keep in mind if you're doing freedom of information requests, like one of the first things that I did was look to see who else requested the same information. There was 3 people. One of them is in this room, Allison Herrera. So then I went out and I messaged her on Twitter, and I messaged another person who was an attorney, and there was a student, I think, also on there. So then there was 4, including myself, who were trying to get this data. And Sharon Astor, who Allison mentioned earlier, had been the only person to report this information 20 years prior. In 2002, released the same data set. And so, yeah, I wanted to fill that gap, what had happened in the last 20 years, 2002 to 2022. And I still am working to try and get that data. It's quite a runaround that they're giving me, but yeah, like just hearing like these 2 people talk about like this history and this trajectory, and knowing what we've all gone through in the last couple of years, it's really, there's just so much to dig into. But so we've been doing different reporting on it. I know that Allison has a piece that she'd want to share from the last year. So
Here's the data set that we both got here, and you'll see those redacted numbers on the side. Those are, so I think we both asked for the same thing, which was like how many from this time period. I asked for the cost because I know that most of those procedures aren't performed in the clinic. They contract out for them. And the redacted numbers, they told us that because the numbers were so small in these particular service areas, it was a privacy issue, and that we may be able to determine who had the procedure and who didn't, which I thought was kind of ridiculous. But anyway,
yeah.
So there was that. But also, I just want to say something about what Pauly was saying about, the instances of where women can and cannot have an abortion. And if you are a victim of sexual assault, there's a lot of hoops that you have to go through. You have to file a police report. You have to file it in within a period of time to be able to get that procedure. And I just think it's ridiculous, the amount of barriers that women have to jump through when it could be a life-threatening situation, when their health and safety is at risk. And I think that's one of the biggest reasons why I wanted to report on this issue. But Audrey, why don't you?
This data set, while you have it up, can you just like scroll up? Like I like comb through this data set, just like stop at the top of any page, like go up right there. Okay, go down actually. Go down to the page you were just on. What I thought was really interesting about this data set was like how frustrating it is to work with IHS. And then they titled this page like in Plains, like go down a little bit more, Allison. Right, Great Plains area. And I was like, what are you talking about, Great Plains area? And they're like, oh, that's a typo. And I'm like, oh God. So like, you can't even get the title of the report right. So this is just not looking very promising. But anyways, I just wanted to point that out.
And I think we both asked for clarification of their policies, because at one point the IHS manual was out of date with what the actual policy was. So I think that's been, I think that they have updated that. But Adreanna, do you want to play your piece?
You want me to go first?
Yeah, you go first.
Let me see.
Okay. So, go ahead.
Let me turn that off. So, is this on? Yeah. So this is from a piece I worked on last year with Rachel Lorenzo. They're one of the at the time one of the only abortion funds for Indigenous people. And I'd reached out to Rachel, I don't know, like a year or two before I even, started doing this reporting. I was just like going crazy on the computer looking up different things, and I reached out to Rachel. I sent like an email and I hadn't heard anything back. And then like 6 months later, since I was still thinking about it, I sent like another email on another portal, and Rachel like sets up a meeting with me. And it's really like stern, like, oh, like you just think that abortion is a hot topic, like now you just want to reach out to me. And I was like, no, actually I sent this email 6 months ago to this email address. And they're like, oh, we don't use that anymore. Okay, let's talk. And so it was just like cultivating a relationship with somebody that I think as Native people, even though I am Native, I don't ever take for granted like the trust and responsibility that we have to these kinds of topics, and to like something like abortion that may like, it's like, oh, like a hot topic. It wasn't really at the time, but it was still like, Rachel's a really guarded and protective person, and I really respect and value what I would say is like our friendship at this point. And so after like being in communication with them, we had so many Zoom meetings that were just off the record, just talking. Rachel says, I really know what I want you to do. I want you to come to New Mexico, and I want you to come with me and my family to a puberty ceremony. And it was really interesting to try and explain that to my editors, like, why is this important? How does it relate to a story? And I'm like, you just need to let me go. Okay, like somebody is trusting me and inviting me into such a private space, like, you just need to let me go. And it took them a long time for them to even see how it fit. So this first few minutes of this piece is actually like some audio of us going through the ceremony, but where I'm going to play about 4 minutes of it is right after we leave the ceremony, and like I have this interview with Rachel at their home. So I'm so nervous. Oh my God, like I don't like my voice, but I don't like my voice, and I don't think I've ever heard this loud, so I might just crawl under the table while we listen. Oh, Lord.
And dancing coming from the arbors of the ceremonial dance grounds. Guests watch the period ceremony from semicircle bleacher seats, while arbors and teepees close off the circle on the other side. The ceremony is a reenactment of the Apache creation story, and in the middle of it all is the biggest fire I've ever seen. Crown dancers circle around the fire, unlocking the door to the spirit world as they dance, while those who are going through the ceremony test their strength by dancing into the night, wearing heavy beaded buckskin dresses, allowing them to become white-painted woman and take on her powers, as she is the model of heroic and virtuous womanhood.
And I had my puberty ceremony in August of 2005. For me, it was one of the most beautiful things and the hardest things I've ever prepared for and ever done.
Back at Rachel's home, they remember their own period ceremony and show me their medicine bundle, which is hanging on the wall in the middle of their living room.
I had to harvest all of these items, and it has like mesquite and minerals in them to make for paint. And so this brush bundle was used to paint my face like white painted woman on the last day of my ceremony. So
the lessons from going through this rite of passage ceremony take years to learn and require working with medicine people in preparation to meet white painted woman. These lessons teach young people to know how to take care of the land and become leaders in the community, which is why Rachel believes Native people have specific needs when it comes to reproductive justice, needs that are deeply holistic and embedded in their cultural history, a history that has also been impacted by colonization.
There is a Pueblo woman who won Miss Indian World in the 90s, and her talent was identifying plants native to the Southwest, and it was in a form of a book.
The Pueblo woman is Shaye Lucero, and her book, Medicinal Plants of the Acoma and Laguna Pueblos, is full of traditional plant knowledge for everyday uses. But what's not included is the sacred knowledge about some plants that would be used for delicate ceremonies, plants that you take to start a period.
How to start your period is code for how to have an abortion. If you missed your period, there are plants out there that our ancestors used to start a period. Like, we've been doing this for a long time.
Over the last couple of years, even before the current assault on reproductive rights, I began researching Native people's fight for abortion access in the United States. The number of abortions Native people receive is extremely hard to pin down because of the lack of access to accurate data, as Native people are often just an asterisk or lumped with other demographic groups. In fact, for the last 20 years, one of the only published data sets available was from a 2002 study put out by the Native American Women's Health Education Resource Center. So I've interviewed more than a dozen activists and advocates. I've submitted FOIAs, pored over decades of reports, and even created my own data set with the hopes of piecing together this scattered history. And what I found in my reporting is that not only is data on abortion in Indian country scarce, but so is access to the service itself. Though the federal government is obligated to provide tribes with health care, decades-old restrictions on federal funding have severely limited the provision of abortion. Advocates like Rachel say those limitations are consistent with the government's long history of manipulating Native people's reproductive well-being. In the past, it has limited access to contraception, sterilized people without consent, and destroyed homes with its family separation policies. And while newly enacted state bans don't impact federal abortion rules, they do mean that Native people who don't receive federally funded abortions will have an even harder time getting the care they need. So for the last year, I've also been following Rachel and the Reproductive Justice Collective, Indigenous Women Rising, or IWR, as they work to fill the gap left by the government's failure to provide adequate health care. A gap that has left Native people struggling to have sovereignty over their own bodies. Since the summer of 2021, the nation's seen the highest number of abortion restrictions enacted in a single year, including the overturning of Roe v. Wade. But Rachel has been advocating for reproductive rights and abortion in Native communities for much longer. Because for a lot of Native people, Roe has never been a reality.
Yeah, so that's some of that piece that I had worked on, and just when I mentioned that I had made my own data set, like I really went crazy at night with a glass of red wine and like pulled all of this like state health reports. It was like, what the hell's going on? And it's just a really frustrating situation. But anyways, I just want to show that. But yeah, thank you. Allison, did you also want to share something? Or,
Hi, everyone. So I report mostly on politics. And so when I was covering this, ictnews.org, okay. When I was focusing on this, I was focusing more on the, oh my God, you know what I should have done? Just Google my name, hold on. That's how I looked it up. One of the ways that I was focused was like, how would this, also I'm a national reporter too, so that's part of it. So I cover the entire nation. And one of the things that abortion care, okay, right here. Also, I just want to say this. I've known of Raquel for a while because I lived and worked, and I also did a bit of organizing work in Albuquerque. And one of the things that I think really grounded me when I interviewed Rachel for a story from the story that I did was they said that, you know, Indigenous communities haven't had access to abortion care, and we've been filling in this gap already. And so we're just going to keep doing that. And when Roe v. Wade was overturned, I feel like I was like in this moment of like despair and like anguish of like what's going to happen, because the overturning of Roe v. Wade impacts automatically. There were trigger laws put in place. And so trigger laws basically ban abortions automatically once it was overturned. And so 63 Indigenous nations in the United States automatically had even more limited access to abortion care. And in the state of Texas, where I also reported for a little bit, one of the things I also interviewed Indigenous Women Rising after the heartbeat bill was passed in Texas, and one of the things that IWR told me was that they had gotten an increase of women from Texas trying to access funds so that they could go to New Mexico in order to access abortion care. And it was really scary at that time to live in Texas because I was living in Texas. And one of the things that my friend messaged me, and it was like a joke, but also like kind of serious, was like, you better put aside money like in case you have to come home to like access care and have that available to you. And so that's just, again, one of the realities. And I lived in Austin, Texas at the time. I would have had to drive 12 hours back home to like get that kind of care should I needed it. Because what they also did is they closed the abortion clinic that was on the border, which was one of the only places available in Texas, in Lubbock. And so they closed that abortion clinic in Texas. And in New Mexico, at one time, there were 3 abortion clinics that then dwindled down to 2 that are both in Albuquerque, in the 5th largest state in the United States. Huge geographical area. Okay. So this is one of the stories that I did. I followed this issue pretty closely when I first got to ICT. And one of the things that I think is really important to note is there were 6 Indigenous members of Congress at the time that Roe v. Wade was like becoming overturned. And 3 of them, including an Indigenous woman, supported the overturning of Roe v. Wade. The other 2 were, and that's Yvette Harrell from New Mexico, she's Cherokee. And then 2 of them were men, Tom Cole and Mark Wayne Mullen at the time. He's a senator now. He's the only Indigenous senator in Congress. And Tom Cole is the longest serving Indigenous member of Congress and has huge influence. He's on 2 of the most important committees in Congress, in the House, and wields a huge amount of power. If he wanted to, he could be Speaker of the House under a conservative Congress because he has so much influence. And so when we're talking about this issue, I think it's really important to also know the political landscape. And part of what could remedy this situation now that Roe v. Wade is overturned is they could pass a bill, right? Congress could pass a bill to ensure a woman's right to reproductive health care, to abortion care. And after, they said it was going to be a red wave. It really wasn't. They got a few seats in the House, so they have the House majority now. So it would be really challenging, nearly impossible, in considering that some of the members of Congress are Democrat, but they're not really. They oftentimes vote against progressive bills because they sit in various capacities. And by that, I mean they're Democrats in majority, like, red places. And so that is the other issue when we're talking about all of this too. But I think that one of the things that, as I was doing this coverage, again, right here, this decision, and these are all the places that had trigger laws. These are all the states that have trigger laws in the United States. And South Dakota, Louisiana, and Kentucky immediately banned abortions. South Dakota has 9 indigenous nations within the boundaries of the state, and Louisiana has 4. And again, here is, I just want to highlight, where's Mark Wayne Mullen? Oh my gosh, you can't see it. Okay, so Mark Wayne Mullen, who's now senator, the only indigenous senator in Congress since 2005, he was like, yay, life, and like all of this stuff, and he's just super against abortion care. And then also right now in the Senate, there's Josh Perkreen, also from Oklahoma, representing Mark Wayne Mullen's old seat. So again, another indigenous person in the same seat. He is part of the Freedom Caucus, which is basically the alt-right in Congress. And so right now, I think, let's see, Tom Cole. And then, what is there 3? Okay, sorry, I'm trying to count them. Anyways, all this to say, there are political issues that are also happening when it comes to this. And the thing about the data set too, I've asked the CDC why Indigenous women are not counted. I also report on maternal health and death. And one of the things that the CDC told me, like I have an email from the CDC basically saying that they will not release that information because we can figure out who has had these like issues that are happening. Like with maternal health, they wouldn't give me the number because they said that the number was so low that I could somehow determine out of the millions of Indigenous women who these like number of women were that had who experienced maternal death. And so that's one of the issues that is happening when it comes to reporting on Indigenous healthcare and statistics. This is not something that's like unique to abortions. It's not unique to maternal deaths. It's like constantly happening. And the language that folks have been using in the United States to talk about this is, what is it? Data sovereign? I think it's data sovereignty.
Data sovereignty?
Yeah, and so we're talking about like data sovereignty and how these institutions need to be collecting this data because the data is so important. Data determines funding. It determines like whether something or not is an issue. So for the CDC to say that there is an issue, like there's an epidemic of Indigenous women dying from pregnancy, they need that data, and currently they don't have it. When we're talking about access to abortion and we want funding for access to abortion, we need the numbers in order to determine like where does that funding go, who needs the funding, and so data is so important when it comes to the United States and access to like healthcare, because if you don't have the data, you don't have money. They're not going to give it to you, and that's why the census is so important. And that's why tribes really push for census data, because that also determines like how much money our tribes get from the federal government. And so it's really important that this data does get collected because there are real impacts to our communities. So.
And it's just like the data that tribes and advocates and families have been pushing for when it comes to missing and murdered Indigenous people, and how that data is collected, and like the various agencies that are responsible, and that also it's an asterisk or it's not collected, or they're not labeled as Native, they're labeled as white or Mexican or something else. And so I think, I think that there has been a big push, for NAMUS to include that data, and for the Department of Justice to be more involved. But I guess, my concern is that there's always a lot of like talk about coordinating and wanting to work together, but I'm not really sure how much that's happening. One thing I wanted to say, you mentioned Mark Wayne Mullen and Tom Cole, both very conservative congresspeople that represent Oklahoma, which is a very red conservative state. And even before the Dobbs decision, they had passed a very restrictive bill that was like the Texas bill, the heartbeat bill, that said that you could be prosecuted, that you could you could be sent to prison, or so before that happened. So before the Dobbs decision happened, that came down, and our Oklahoma governor signed that law, and there was a lot because Oklahoma had that huge decision, the McGirt decision, which ruled that 42 or 43% of the state is reservation for purposes of criminal jurisdiction. So this means that the tribes or the federal government have the ability to prosecute violent crimes when it involves a Native person. And so after the governor of Oklahoma signed that heartbeat bill, there was a lot of talk about, we can have an abortion clinic on the reservation, in Tulsa. And this so offensive to so many Native people, because the talk was coming from a lot of non-Native people who I think never really cared about Indigenous women's health or issues until their own access was being threatened. And so, you know, daily on Twitter, there was like, well, this law could be invoked, and it's about sovereignty, and we could. So if this, various situations were proposed about, the legality of proposing of opening an abortion clinic in the city of Tulsa, which is a large metropolitan city that has a lot of Native and non-Native people that live in that. Within that area. And so where I work at KOSU, we decided, okay, well, we're going to, our biggest, the service that we can provide to people is to talk about why that can't happen and why it's offensive to even talk about that happening without the consent of tribes. So we did a Twitter Spaces. We immediately drew people in and started to get, we had some health experts in, Stacy Leeds, who is a really big, an attorney, Cherokee Nation, was a judge for the Muskogee Creek Nation, and just to talk about why that can't happen and why and how offensive that was. And the other thing we did too was people were asking us after that law came into effect, can I even access birth control? Can we even, can I get my birth control refilled? And so we recognized that our duty as, myself and the other two, the health reporter and our engagement reporter, just really reaching out and publishing stuff about here's a FAQ about what this law means. Here's an FAQ about abortion in Indian country. Here's what you need to know. And I think that was one of the biggest things that I saw after the Dobbs decision, and even before the Dobbs decision, about the discussion about abortion access in Indian country and how it could benefit non-Native people, and how that criminal jurisdiction status and that hard-fought decision that really Native people in the state of Oklahoma, fought for years for, how could it benefit them? And I think that, to me, was something that was really striking and something that needed more reporting. So,
and then I just want to add also on the Supreme Court, because I cover sometimes the Supreme Court as well, is that we have an extremely conservative Supreme Court here in the United States, and Justice Clarence Thomas, who is the most conservative justice, in his court opinion, in the Dobbs decision, said that, in fact, we should relook at people's access to birth control. We should relook at things like interracial marriage and gay marriage and all of these huge wins, right, that happen through the Supreme Court, and we should give them back to the states to decide. So in the United States, we have this thing called states' rights, and so every state is their own sovereign entity, and they make their own, they have their own state laws as well. And so the Dobbs decision, the way that they did it is that they basically said, we're giving it to the states to decide what they want to do, and that basically it was an overreach for the federal government, for the Supreme Court to determine all of this, that it should go back to states' rights, right? That's how Roe v. Wade got overturned. And so I think that that's also something that's really important to note, is that in the United States, this is an ongoing battle. The conservative agenda continues to push for this. They have been working on this since Roe v. Wade was enacted. And it took them, until last year to finally get it overturned. And so this has been one of the agenda items for the Conservative Party for many, many decades now. And as we look forward, the Supreme Court continues to be extremely conservative. And in the United States, the Supreme Court justices are picked by the president. And so and they serve lifetime terms. They cannot be removed. They just stay there until they die or retire. And then the president at that time selects who replaces them. And depending on who you get, like whether it's a conservative or a Democrat, that's who gets placed in that position. And also the Senate has to confirm them too. So if you have a more conservative Senate or if you have a more liberal Senate, then that also determines it. So there are a lot of political pieces of this bill.
You know, Pauly, you said something earlier about data sovereignty, and it reminded me of something. I spoke to Abigail Echohawk. She's a director of the Urban Indian Health Institute, and I know we're sitting here talking about like how hard we've been trying to like get this information, but she said something that really stuck out to me, which was that, you know, getting it and having it and being able to share it is so important for all the reasons that we just listed, but at the same time, when it comes to data sovereignty, we also have it as a protection for ourselves. And I know, I was like, oh my God, you know, because it's like how you're saying that it can be counted for funding, but it can also be like counted against us. And so it's like having our information for ourselves and what that truly means to be sovereign is something to keep in mind when doing this type of work and what it means to, you really start to just question like what it is that it means to have like our sovereignty over ourselves and also over like our information, our data, our health information. So you saying that just reminded me. I think
one other point I wanted to make too is that, you know, I think what's come out of this reporting for me is that it's not just about reproductive access, it's also about access to just general health care. Like, how far away are you from a clinic when you're pregnant, when you need a checkup, you know, if you need access to emergency contraceptive, which is a story that I'm working on right now. I'm looking at that data. Those are really important things. And I think just general health care and how well funded IHS facilities are, is really important. So, that's something that's come out of it for me, but I realize we've been talking a lot, so maybe if y'all have any questions.
Yeah, I want to open up to questions now at this point.
We talk a lot about the challenges of data. I wonder if you could speak a little bit about some of the decisions you make about what stories to cover and what not. Like, I'm just thinking as you're talking about the trigger laws, when that happened, Roe v. Wade was overturned, and because North Dakota was one of the states that did the health clinic in Winnipeg here saw that the big uptick of women coming over the medicine line to get those services. But then I started thinking about how, like, well, but a lot, even the place where you go to get an abortion is a very secret space here, and it's like maybe you don't want to do some of those stories because you don't want to draw attention, but at the same time, it's important. So I just wondered if you could speak to some of those dilemmas that you might face in even just choosing your story.
I mean, I think that's a really important point about not exposing, but telling people like, oh, we're going to profile this clinic, you know, and that potentially opening that the people that work there and the people that go there to violence. I mean, the story that I was going to show also featured Rachel Lorenzo and Leanne Lorenzo, her mother, their mother-in-law, and I drove around with her as we went to different clinics in Minneapolis, and you know, talked with them about their services and asked them like how many people they were getting from different states, and like how many of them were Indigenous women, and like, you know, I was like, I can't report on this. I can't like, you know, record her like in this clinic because one, I didn't ask permission way in advance, and two, I'm not going to put these people in harm's way. You know, there were people, you know, 50 or 100 feet from the clinic protesting, and so I think that's a really important. I think I feel like I'm not answering your question, but I'm echoing your concern. I think more it is just like, you know, when you were saying, Adreanna, about the uptick in the number of people that have utilized Indigenous women's rising services and the number of people, you know, since the trigger laws have gone into effect. I think that's a really important story. And I think one of the things that's important to me is to look further at how many women are, you know, just going back to that data set, how many women are trying to use Indian Health Service for these really important services and being turned away or being told, you know, we don't have the money to provide that for you.
I think for me, when it comes to answering that question, I really deeply care about the safety of the people who I interview. Like, that's something that is of the utmost importance to me, because I'm very anti like martyr. I don't want people to die for, like, I can't. And so if I feel as though somebody is not already in the spotlight or has not already said, like, this is something that I'm comfortable with, like, I won't interview them, even if they want to. Like, I just won't, because I'm like, your safety matters more to me than you being a part of this story. And so I would pick people who are already vocal, who are already in the spotlight, who already know how to take care of their health. The thing about Indigenous Women Rising is that I know the community in Albuquerque and the activist community, and they are very well aware of how to take care of themselves. They have like all of these trainings that they go through when you're doing community organizing work in the area. And so I know that they have been trained on how to keep themselves safe, and how to limit the amount of information that is available and online. And so that to me is really important. And so like I interviewed people who I already knew were very vocal, who had been trained in like ways to keep themselves safe. Because again, like abortion is an extremely controversial topic, and people do, like, there are altercations, there is violence around this issue. And when it comes to Indigenous women and femmes, like I am super protective. And I never want somebody to experience violence because of an article, or harassment because of an article I did.
What does that mean for you guys when you're reporting on these issues? You know the activists who have these measures in place to keep themselves safe. But as Indigenous women reporting on these issues in their own communities, don't want to talk about it, what does that do for you and your safety and your access to other information and interviewing other people if you're the ones who are telling these stories?
I think personally, like I've never really even thought about that, because the good thing about me is that people don't really know where I'm at all the time. So because I'm like traveling all the time, and so like people say to me all the time, they're like, I don't even know where you are. Like, are you in New Mexico? Are you in DC? Like, where are you? And so I feel like that's something that's really important to me, is just the fact that people don't really know how to access me. And then the other thing for my own personal safety is that obviously I just like use my work phone all the time. In the United States, it's really accessible to get people's home addresses, their phone number. Like, it's just super accessible because it's like public information. And so if you buy a home, people can look that address up if they really wanted to, because it's public information, and you pay like property taxes. And so they can, if they want to, they can find you. And so I think that that's something really important to keep in mind when you're talking about this. But for me, I'm like, I rent, and so I feel pretty safe in doing this kind of reporting, also because I'm away, right? And I'm in DC, and it's probably one of the most watched areas in the country. Like there's just such a heavy police presence everywhere. In where I live, and I live in Capitol Hill, so I live just a stone's throw away. But yeah.
Yeah, at the time when I was doing this reporting, I was working at Vice, and we had done like a listener survey for whoever listens to our podcast of what they want to hear more about or less about, and it was insane that people were like, less abortion, less like reproductive stuff, less gender stuff, and I'm like, we haven't even had a reproductive like thing on our show yet. And I do a lot of cybersecurity to try and prevent from getting doxxed and whatnot, but I think it's like the same respect that we take for our sources that we have and wanting to protect them. And I become very protective over my sources, or over the people that choose to share their stories with me. And I don't know. Yeah, I guess they both were like, I never even thought about that. And I thought the same thing too, like beyond like what I can do with protecting myself and my data online and who I am. But just, I mentioned where I worked at Vice because have a lot of people who like to say a lot of stuff to us there at the network. So I felt like I'm already having this hyper like attention, on me as, somebody who used to report for them either way. So, yeah.
I think, in Oklahoma, which is, we're home to 39 tribes, they wield a huge economic impact in the state. I mean, they are like the second or third employer in the state. And I think one thing Pauly, you touched on a little, is that, that's a sensitive topic within tribal nations. Sarah Deere said to me, one of the sources I interviewed, and she teaches at KU, and she is a Kansas University, which is like just above the state line from Oklahoma, and has worked for I think she did security, or she was like worked really closely in the 1990s when I can't remember the doctor's name, when that abortion doctor was killed. And so she's a Muskogee Creek, and she's a law professor. She told me, no tribe wants to be known as the abortion tribe. No tribe wants to offer that service, wants to be the first to offer that services for their people. And I thought, God, it's just so depressing. But at the same time, tribes in my state, they're very, Southern Baptist, go to church on Sundays, are very, very religious. And they also, even if tribal leaders did hold differing views from their citizens, there's a very big rift between tribal leaders and the governor in the state. And there's lots of tension around the gaming issues and issues around hunting and fishing in the state, and just sovereignty. And so tribes don't want to be seen as going against the grain of states' rights, because that puts them in the crosshairs. And I think as a reporter who tries to listen to both sides, whatever that means, on this issue, trying to really be, hearing people out, and but also trying to make it known that this is a service that a lot of the women that I've talked with, either on the record or off the record, want, and I think that's really important to report. So.
That's a really good question. I just feel like called to answer it because I mostly have worked in non-native spaces and have often been the only Indigenous person in a room, and navigating that has been really, really challenging. It's hard. It's really, really hard. I think when you know that, like when you're certain of something and the validity of it and the truth of it is so important, like it may be hard to just like speak out and like push back. But to be honest, like those are just some of the things that you have to do. Like I've been in newsrooms where people are like, oh, we already did one Native story last year about this. And I'm like, oh, forgot that was the only one we got a year. Like, how do you, or we did another story that was about cultural this or that. Like it's really, really frustrating. And I think that spaces like this, like NAJA, like the resources that we provide that are able to add to the conversation of like, not only like why, but like how to do it, are just like, oh, it's a lot of work. But I guess if I was to speak to like Raven, my mentee, like, I don't know, you already have it in you to like do great things. And so No, don't cry. I don't have tissue. But I don't know. Like, let's lean on it. Like, we should just lean on each other for that support. Like, reach out to each other for that support because, like, we're not alone. We're not. Like, there are other people reporting. There are other Indigenous people, strong Indigenous people. I mean, I reached out to Allison Herrera and actually looked up to her a lot for the work that she had done. And
so sweet.
and yeah, so I mean, we're not alone in this. And so just like, yeah.
There needs to be a guide. There needs to be an internal, well, it's not NAJA anymore, but there needs to be a guide on how to report on abortion in Indian country. And I think, I remember seeing a CNN headline after the Oklahoma law went into effect about like, could there be an abortion clinic on the reservation? I was like, this is probably the only time CNN has ever used the word reservation in any headline ever. And so I think it's really it's pointing out it's the disparity, right? Like, if you can't, talking about this sort of like separate and unequal systems of healthcare, which Indian Health Service has, and to talk about, here's one part of the population that relies on this service that's a treaty right that they're supposed to have, and then here's how the government is like really underfunding that. I think that's a great way in to advocate to do coverage for Indian Health Service, and not just on reproductive rights, but on other things. And one thing too, with Indian Health Service communications persons, these are the people that we have to reach out to talk with. They're more than happy to reach out to you when there's a story about a new diabetes funding, which is like so stereotypical, but like they don't want to answer your question when you have something about like, well, why does it say this in the manual when I see it printed, like what's the, when talking about disparities in health funding when it comes to women's access, and just this, the rhetoric that I hear around like, we value our women, we value our, our sisters. It's like, I can count on one hand how many times you've reached out to me about when it comes to an issue of reproductive rights. And I think it's really, to me, it's about holding IHS accountable. Above all else, it's really looking at what is IHS not doing. So I think that's one way you can tell your newsroom editor or other reporters or any of those people, this is, ultimately it's about holding this federal agency accountable for what they are not doing.
And I don't work in non-native newsrooms. And so one of the things that I give my advice to young Indigenous journalists is you don't have to do that work. There are spaces that exist where you don't have to. You can be in a space like _, like ICT, where you are supported and encouraged, and your work is valued, and you have people who say, that's an important story. I believe in you, and I'm going to give you funding to do that. And so there are spaces that exist, National Native News, Native America Calling, like there are so many spaces, APTN, where you can just do the stories that you want to do, live how you want to live, where you don't have to fight all the time. If that's not something that you are not passionate about, that's something that I never want to do. And I've been very strategic in my career where I choose not to do that work. I just want to go into work and be happy and do what I love and have people who just encourage me and love the ideas that I have. And I don't have to fight all the time because I have to do that every day when I leave my house. And I live in DC. And so it's even, I feel like it's heightened there because I'm in the capital of the United States. And it's already so daunting and so difficult in my everyday life that I choose not to do that at work. And so that's also the advice that I give to young Indigenous reporters and to just Indigenous reporters in general is you can opt out of that system.
Thanks so much for coming, y'all.
Thank you.